diabetic eye disease or diabetic retinopathy, which is disease of the retina, and the retina is that layer at the back of the eye which captures light and passes it to the brain. Of course, the retina is supplied by blood vessels, but in uncontrolled diabetes, the blood vessels of the retina become damaged, and this reduces function of the retina. Now, initially, you may not have any symptoms, or you may just have mild symptoms. However, if it is left unchecked, this can lead to blindness. Diabetic retinopathy can occur in type 1 or type 2 diabetes. And of course, the length of time you have uncontrolled diabetes for, as well as how poorly it is controlled, play a role in how quickly this condition progresses. So, what are the symptoms of diabetic retinopathy? Well, there's blurred vision, then there's also floaters or dark spots or strings floating about in your vision field, dark or empty zones in your vision, and of course, possible vision loss. What exactly is the mechanism of diabetic retinopathy? Now, when your blood sugar levels are too high for an elevated period of time, the tiny blood vessels of the retina become blocked, and this of course will reduce the blood supply. And of course, reduced blood supply to any tissue leads to a reduction in function and possible tissue death. Now, the eye will attempt to grow new blood vessels in an effort to normalize blood flow to the retina. However, these new blood vessels don't develop properly, and they also leak at times. So I will speak about diabetic retinopathy in terms of two stages: the early stage and the advanced stage. In the early stages, the walls of the blood vessels just weaken and tiny bulges form, and sometimes fluid and blood leak into the retina. Now, because of the fluid that has leaked into the retina, it may swell, and when it is examined by a specialist, white spots might be observed during the dilated eye exam. Now, what happens as it progresses from the early stage into the advanced stage? As it advances, new blood vessels begin to grow. Scar tissue may also form, and this may lead to retinal detachment. The new blood vessels can also obstruct the natural outflowing of fluid from the eye, and this can cause a pressure buildup within the eye, resulting in glaucoma. This increased pressure on the optic nerve can result in blindness. So what exactly are the risk factors for developing diabetic retinopathy? The obvious one will be having uncontrolled diabetes for a long period of time. However, there can be other compounding factors riding on top of uncontrolled diabetes that will accelerate the progression of diabetic retinopathy. So there's also high blood pressure, also known as hypertension. There's elevated cholesterol, and also smoking and pregnancy. So now the obvious question is, what can I do to prevent diabetic retinopathy, or at least slow down its progression? You need to ensure your diabetes is well controlled. You can do an HbA1c test to properly monitor your condition and determine if the lifestyle changes you have made are actually working. Keep your blood pressure and cholesterol within acceptable limits with diet, exercise, and the appropriate medication. Again, use a blood pressure machine and blood work to ensure that you are on track. You are not to rely on guesswork or subjective feelings. I encourage you to perform an HbA1c test, which is an objective test. Also, begin the process of quitting smoking. If you are finding this difficult to do, know that there are doctors that specialize in helping people quit smoking. And of course, you need to have regular eye exams so problems can be caught and dealt with as quickly as possible. So I hope you have enjoyed this talk on diabetic retinopathy. If you want to book a dilated eye exam or book with our diabetic specialist, you can call 747-5297 308-3370. We are located at number 4 Chincuna Gardens, Chinchin Road in Cunupia.